Hi, in today's video we'd like to talk about biochemical pregnancies or chemical pregnancy, the cause and treatment here at Antai Hospital. So biochemical pregnancies or chemical pregnancies are known as very early miscarriages that happen during week 3, week 4, or very soon after you just tested positive for pregnancy. This form of pregnancy can come to as a shock to many pregnant women, especially those that are first time, because it really drops away your hopes and dreams. When you're just found out that you're pregnant, very quickly you miscarry because it comes out with your first menstruation as well. It comes out with your period as per usual, where normal people, they don't really have periods anymore. The period process will cease when you get pregnant because of the endocrine system. However, these patients, when it's approaching your normal regular menstruation timing, this pregnancy will be terminated, flushed out. So this is how it happens extremely early, week 3 to week 4. Some are happening even earlier than that. So this form of pregnancy, because of how early it happens, we consider it as an immunological miscarriage. Many hospitals nowadays, even doctors worldwide, they don't believe that there is a treatment for this condition. But here at Antai Hospital, we have not only diagnosed patients with this, we have properly treated them over the past 20 years because we understand what is going on. So chemical pregnancy, the primary cause is due to the presence of this immunological factor. So this immunological factor means that there is a specific antibody in your system known as anti-embryonic antibodies. Now this antibody is coined by our founder of Antai Hospital, Dr. Chen Feng. He coined this because he discovered this antibody during his research in the early days, 20 years ago. And he has even patented this treatment and diagnosis for this form of miscarriage, which is an immunological miscarriage. Now, if it happens over and over again, which it very well can because of chemical pregnancies happening so early, sometimes you have no awareness that it has happened. Sometimes some women get pregnant and miscarry at the same month, and they completely did not realize it happened. Now this can happen repeatedly, so we consider this as a recurrent miscarriage. The more times it happens, what happens? It gets more severe. So it happens much quicker now. It can make you very difficult to get pregnant, and then to the point that you may be effectively considered infertile. So it must be something that we put a lot of emphasis in and seek proper treatment. Now we can diagnose the presence of this antibody very quickly just doing a standard blood test here at the hospital. Because it is our patented discovery, it only is available in our hospital. So we are proud to say that we can actually properly diagnose your chemical pregnancy and have you treated as well. No other hospital can give you this claim, but we can, and it comes with a full refund guarantee. So let's say you receive our treatment and you still miscarry the same time, or you don't have any pregnancy, then we offer you a full refund guarantee because as of now our success rates is at least 95%. That's how effective the treatment is. The treatment is effective because we understand the root cause, which is the immunological factor, the presence of these antibodies. They are attacking the embryo during the early weeks of implantation. So let's say this is the endometrium, this is the embryo. During week 2, week 3, it's still implanting on the endometrium, not as deeply as we want it to be because it's still unstable during this period. So it's trying to implant itself deep inside the endometrium into the basal layer, but because of the presence of anti-embryonic antibodies, it's attacking the roots and also the embryo as well, wherever it can expose itself, affecting this pregnancy and then causing an early pregnancy loss. So our treatment is simply intravenous injections. This treatment is patented in over 30 advanced countries, including the United States, China, and Europe, and has approval from several scientists and medical institutions, and administered intravenously, so you don't have to put down any pills that you might feel uncomfortable with. And after you receive this treatment, you have a 6-month window to quickly conceive and have a pregnancy, because anti-embryonic antibody can only affect your pregnancy for the first 12 weeks, because after that your pregnancy will be stabilized, sufficiently large, and has the protection from the placenta. So the first 12 weeks, this immunotherapy can protect it, allow it to sustain for full term. So for more information on treatment for chemical pregnancy, which is a very common form of miscarriage nowadays, more people are realizing that it's happening. There is a treatment for this, and it's only currently available in Antai Hospital. So visit the website, set up an online consultation today, and let us arrange a treatment for you today.